To say I'm Deb Foxcroft. My Kuas name is Quilts. I'm from the Tishot First Nation here on Vancouver Island, Port Alberni, West Coast. I just wanted to welcome you here to our territory, the unceded territory of Tishot. I'm wanting to just say welcome again. And I am a wife, and I'm a daughter, and I am a mother and a grandmother and a sister and auntie and an elder now. So I just wanted to say to everyone, just welcome to all of our respected elders, our knowledge keepers, elected chiefs and council, hereditary chiefs, matriarchs, boards of directors, CEOs, CFOs, First Nations child and family service providers, youth and children who may be joining us, and special guests and presenters. So before I start, I just wanted to say that, please join me in a prayer. I will be doing a prayer from the unceded territory of Tishot here. And I wanted to just say to everyone, however you feel comfortable about praying, you can please do that with me. And I just wanted to say that, I just want to acknowledge everyone from, I know people on here are from across Canada. And so welcome to our guests. So I'll just start. So Nos, Creator, Great Spirit, thank you for this beautiful day. Sending prayers and love to anyone who has had any recent losses and are grieving today. Give them strength and protection. I welcome and acknowledge all of you that have joined this circle today, this afternoon, who are bringing their knowledge and wisdom, compassion, and so much love to support and to create a better place on behalf of our children and youth and families. This is so important work. This is so important. And I just wanted to say that, just ask that Creator, you, Nos, give us strength and courage to move forward together in a good way. And on behalf of our children and our youth and families, I know we want to ensure that our children are learning our way as we move forward together. And I ask that, and I know that they've been waiting for a long time for this day. I pray that we can move forward for the betterment of all of our children and youth. Usak shikleetsu, kleko kleko chu. Thank you.
Thank you, Deb. I would like to first, for those that are new to the call, like to say welcome, and for those that have attended previous information sessions hosted by the Secretariat, welcome once again. Just a few housekeeping items. If to ensure the audio for our presenters, please make sure that you are muted. If you do have any questions throughout the presentation and would like to place your question in the chat, we have a number of our Secretariat team available to monitor the chat and keep track of questions for our panelists. And for those that would like to ask the question when Q&A, when there is the opportunity for Q&A at the end, please use the raise hand option so we can see you. There's a number of people There's quite a few of you on the call today, so to be able to see and to go in order, and you'll see our host is the Indigenous Child and Family Services Secretariat, which is Michelle, who will be assisting, as well as Kayla Swing, to be able to keep track of all of the questions. So again, we are being hosted by the Indigenous Child and Family Services directors, and our home is Our Children, Our Way, if you want to know more information. Today, our panelists is Regional Chief Terry Teegee from the BCAFN. We have Dr. Steve Blackstock from the Caring Society, Mary Teegee, our chair of the Indigenous Child and Family Services Directors. We have Dr. Helaina Gaspard from the Institute for Political Studies and Democracy, Angela McCarthy from ISK BC region, as well as Gregory Miller, BC region. I'm going to hand it over to Regional Chief Terry Teegee for some opening words before we hand it over to our panelists.
Let's see, Deneza, Tsekoza, Skyza. Just first of all, I just want to acknowledge the territory that I'm calling from, the Claytley Tene, the Dakat people in North Central British Columbia. Thank you, Lori, for allowing me to say a few words, and thank you, Deb, for that prayer grounding us in a good way. So I'll just set some context of the agreement and principle and where we've come from. And certainly this is born out of Canada, the federal government's First Nations Child and Family Services Program. What we know through the court case is that for decades has been really exercising discriminatory funding practices towards our First Nations children. And high levels of First Nations children were placed in care during this time. The court case began in 2007 with the Assembly First Nations and Child Caring Family Society, and culminated in a really decision back in 2015-16, where there's a decision by the Canadian Human Rights Tribunal issued a landmark ruling acknowledging said practices, and really demonstrated that there needs to be a follow-up to the federal court decision. And Canada then felt it necessary to commit to negotiations of settlement. The Assembly First Nations and the class action suits such as Mushoom, Trout, Jordan's Principle, and Canada have been negotiating for a number of months here since really December or November of 2021, and came to a conclusion of sorts of a draft agreement in principle on December 30th, 2021. Negotiations from the Assembly First Nations in many respects were led by Regional Chief Cindy Woodhouse, who's led this portfolio, as well as the Assembly First Nations legal and many of legal minds in terms of the class action lawsuits and those that intervened, such as the Chiefs of Ontario and the NAN group out of Ontario. More recently, the parties have achieved a final draft settlement. I believe that is shared publicly and based on the AIP agreement regarding compensation. It's quite comprehensive and includes provisions on all cases, and the total compensation is upwards of $20 billion. And the other half is on long-term reform, which is the other half of the $40 billion settlement, is the long-term reform that is still in discussions. The final settlement agreement must be approved by the Canadian Human Rights Tribunal, and I believe that is the case with many of these parties to go in front of the Canadian Human Rights Tribunal to state perhaps the provisions were lived up to, and by the Federal Court of Canada. One of the things that we are concerned about here in British Columbia is that solid commitment that $40,000 is the floor, and there is a solid commitment to those that deserve compensation, that $40,000 will be adhered to. And if not, then perhaps those claimants would perhaps have the opportunity to opt out and perhaps seek the $40,000 in a different venue, if you will. So we also here in British Columbia have a session coming up to on August 30th here in British Columbia to talk about this agreement in principle on long-term reform and perhaps even compensation if we can get there in terms of the overall settlement of the $40 billion, $20 billion, the first piece of compensation on two plaintiffs that were in care post 1991, and then there's also the $20 billion to really, I think, as we take over jurisdiction, as First Nations implement Bill C-92 and really assert their sovereignty over jurisdiction and draw down jurisdiction on child welfare, that they're properly resourced. So this is really important as part of this conversation and the agenda today. The big piece of this is knowing that we have the data, what it's going to take in the future to take over this very important matter in terms of making sure that our children are safe. For far too long, they haven't been as part of the child welfare system in all our respective provinces. So I think it's important discussions, not only today, but in the future in terms of really understanding what is at stake here is making sure that the children are properly compensated, nobody's missed, and that we're properly resourced as we move forward, as we draw down jurisdiction. And really there's two agreement and principles here that have been worked on for a number of years, but really negotiations began in November of last year. And that continues to be negotiations as we speak. So there is, I believe, a public document on the draft final agreement, but even I believe in that is perhaps being changed as negotiations continue on. So I'll leave it at that, and thank you, Lori, for allowing me some time here, and thank you to the organizers here for allowing me to really at the stage of where we're at. Thank you, Basicho.
Thank you, Regional Chief. I am going to share my screen once again. Give me a moment. And we are going to welcome Cindy.
So hello, everyone. I'm joining you actually from Treaty 1 territory today here in Winnipeg, and it's a real honor to be here. Thank you, Deb, for the prayer, and Regional Chief for the overview. I'm not going to repeat a lot about what the Regional Chief has said, but I will kind of maybe go into a little bit more detail about where we are and what some of the following steps are with the graphic. So Lori, if you're able to kind of bring up that slide. Okay, so there we have the decision, and it was really important to understand it. The 2016 decision substantiated discrimination, not only on child and family, but also on Jordan's principle. And the Canadian Human Rights Tribunal has authority to make sure that there are safeguards against the government doing this again to kids. So it has to really be satisfied that the discrimination is stopped and will not recur in child and family services, in Jordan's principle, and in departmental reform. So those are the three buckets that the tribunal has jurisdiction over. Because Canada was so slow chose, frankly, not to implement the order. We've now had 22 non-compliance and procedure orders at the tribunal and 3 federal court orders since that 2016 decision. So it's been very difficult, but with all of our support and all of your good work, we've been able to move to a place where about 75% roughly of the 19.08 billion that was announced for long-term reform for child and family and Jordan's principle has been secured via legal orders. So now we're looking at 25% of that amount, about $5 billion. And again, I just want to underline the agreement in principle is only for 5 years. We all have to make sure that the discrimination stops forever, not just for 5 years. So that 19.08 billion amount, that's only for 5 years. 75% of it's already locked in. The question is, well, how do we then plank in the other pieces? So you saw some of these immediate measures come down in April, and it really was in prevention services. It was in capital for CFS and Jordan's principle. Also funding for prevention for First Nations not served by agencies, because they've been receiving it from the department or from provincial governments. But obviously the prevention services weren't adequate. So now the funding goes directly to them. And we are in the process with Helaina. And if I could make one cheerleading call for you, it's to participate in her research, because we really need you to have your voice heard in whatever this long-term funding approach is. And right now, only 18% of First Nations agencies have participated. We got to get that number up, because we want to make sure that we're really collecting the information from the ground. Same with First Nations not served by agencies. So I'll leave that for Helaina later, but there's my big cheerleading thing for the whole thing. I'll go with the compensation orders regional chief covered. They're really about the Canadian Human Rights Tribunal made human rights damages. Those are different than class action damages. They said just by the child being removed, that child deserved $40,000. And then the class action for everything that flows from that removal, then that child should be compensated even more. But 40 is the floor. And I couldn't agree more than with regional chief that 40,000 is what these people are legally entitled to. And we have to look in this draft agreement that's been come up with by the class action people to make sure that those entitled to 40 actually are still getting at least that amount. Because under the class action final settlement agreement, which is still draft, the idea is people that are covered under that waive their rights to litigate against Canada again. So that's another important thing to look at. And I posted in the chat the draft final settlement agreement. Now, on both of these, as the regional chief has said, these agreements in principle, they are not binding, but they set a framework for a final agreement. When that final agreement is settled, that has to go to the tribunal. And in the case of the federal court, compensation will go to the federal court as well. So I'm going to leave it there, because I know we have a lot of great experts coming after me. That's just my beginning overview. And I think Mary's after me, Lori, right? So I'll turn it over to her.
Thank you, Cindy. Mary?
Good afternoon, everybody, and I'm so honored to be here. I'm coming to you from the traditional territory of the Lheidli T'enneh people. And Skyze. I'm Mary Teegee. I'm a Mountain Gabu. White Wolf is my hereditary name. I'm Gixon and Carrier, and I come from Takla Nation. I'm also the chair of the Indigenous Child and Family Services Directors Forum here in British Columbia, and I'm a member of the NAC, and I'm also a board member of the First Nations Caring Society, and it's always an honor to be here. So I'm just going to generally talk about some of the things that really to think about. I know the monies that have gone to the nations, the prevention funding, there's a capital funding at actuals now. There's also, of course, the band designate funding. and also the post-majority at actuals. And that really stemmed again from the long-term reform negotiations that occurred, and culminated in on December 31 at 4 o'clock. We know that it was very, very stressful at the time. But I think what the key principles here really, at the end of the day, when we look at what's happening now, we have a draft compensation agreement that you can access that was filed federal court. And then you have the second portion, which is the agreement in principle long-term. And again, the agreement in principle long-term reform, the prevention funding, all of the other aspects, as I talked about, the band designate funding, the post-majority, and the capital, is to ensure that there was no more discrimination. As Cindy talked about, the CHRT very clear. There's the three principles that there would be, that discrimination had to end, that discrimination wouldn't occur again, and then of course the compensation. So what is really important within the agreement in principle is the notion of holistic wellness and how you decide what is prevention. Oftentimes, I know across the country, having the opportunity to travel across the country, many of our child and family agencies, that's all we've done is provide child and family, but there's also a whole host of agencies that could be deemed prevention that's within those traditionally, say, health type of services. When we think about holistic, we're thinking about not only the whole person, but the whole family, the whole nation. Cultural pieces, early childhood development. You have a healthy baby, you'll have a healthy child, healthy adult, and healthy parent. So we really have to make sure that when we think about holistic wellness, we're thinking about the mental well-being of our families as well, the physical well-being. So when you're thinking about moving forward with those prevention funding, all the new funding, remember that it has to meet the needs of our community. And again, that is a principle that we need to look at. The services that we provide have to be based holistic, based on need, but also has to really be in a appropriately culturally. So I think we also know that the funding has to address the structural drivers. And again, what are those structural drivers and root causes? Structural drivers are things that are beyond the child and family's control. Things such as poverty, housing, all of the issues, like when our children were removed so bad in great numbers, oftentimes you'll see that the reason was neglect. And oftentimes it was because of things beyond their control, overcrowding in houses, not being able to get the right healthcare, not being able to have the appropriate food, and those different issues. Of course, we know the root causes. Again, we cannot look at figuring out how to move forward without looking at our past. We know that the historical legacies, the impacts of residential school causing the self-medication of alcohol and drugs. So these are things that we think about, that we thought about, that we knew was so important moving forward with the great agreement in principle and ensuring that those principles are embedded within the final settlement. We also have to understand that those historical disadvantages has caused us to be here today. And oftentimes the cost of providing services to heal the rights of the wrong, to look at trauma-informed practices, things that work for our people may cost a lot more. So we need to ensure that when we're looking at funding, that it's flexible and actually meets the needs of our nations, but also it has to be long-term funding, block funding. So I think that's so important because Helaina will speak to this. We definitely know, we don't know at the end of the day, especially here in British Columbia, what the cost of prevention is. So we need a funding approach that's going to allow for nations themselves to self-determine. It's going to allow for the culture to come through, and it's going to actually deal with the impacts of residential school and colonization. So one day, no child will ever have to say, I'm suffering from an impact of residential school. And so that's really what we really try to embed within the agreement in principle. I think it's also important to note here, within the agreement in principle, throughout the agreement, you will often see where right in the agreement it says the parties agree that First Nations youth and young adults with lived experience in the child welfare system and those who were denied services or adversely affected by Canada's failure to fully implement Jordan's principle will provide advice on long-term reform. The parties will discuss the best mechanisms for their voices to be heard in a safe way and the capacity supports that are required, including the possibility of funding by Canada. So any type of an agreement that goes forward, we have to ensure that we're including the youth voice and also the ones that were impacted by residential school. So any type of draft agreement, we have to make sure that there has been that voice, that we are doing things as right as we can in this at this time. So for example, we have a long-term, we have the draft compensation. We do have to go back and say with the youth and what mechanism are we going to get their voice? Like we have different ways that we've been working with the Caring Society, having the Youth Care Network, having different groups, the 7 generations of youth, providing their advice into what compensation would look like, into what agreement in principle would look like. And they've given us advice as to how to consult with youth. There's a lot of good work, but we just actually need to make way for them and make space to have all that good work reflected in everything we do, especially when it comes to finalizing and agreeing on the final settlement agreement. Cindy had talked about, within the 5 years, this agreement is within 5 years, and that's the funding commitment. And as the reformed funding approach, child and family funding approach, states within the agreement in principle that funding shall be distributed across fiscal years based on the actual needs of First Nations children, youth, and families, and the unique circumstances of First Nations. So that's across 5 years, but we have to ensure that there are mechanisms in place after 5 years to ensure that those principles that I talked about are embedded and moving forward. And that way we will ensure that the CHRT's 3 principles to end discrimination, never for it to happen again, and for compensations are abided by. We do, I think we need to really, we always know that whatever we do is going to affect, 7 generations. But in this instance, we're here at a pivotal time in history. We've been working and been at court since 2006, 2007. And now, we're in 2022. We definitely have to make sure that the data, that the information that we require to really mold the final settlement is that we have that. So again, the importance for chiefs and leaders and people in your community to go and to fill out those surveys that the Institute of Fiscal Studies and Democracy, Helaina Gaspard at the University of Ottawa, when she comes on, to really do that, because our children deserve to have their voice heard. And especially those really remote communities, we really need to hear from you, because we need to know what the cost is, because we're definitely going to look at a funding framework that's going to reflect who we truly are as Indigenous people, and to ensure that we have everything that we need to ensure that we're taking care of our children and families now. Okay, so again, some of the one thing that I wanted to highlight, we have the, Helaina will come on to that, but again, to really look outside the box of what was traditionally child and family, and to look at what prevention means to you in your community. We know for things like culture camp, even language classes, we have all of those issues around the lack of housing. We now have a capital at actual right now. So really look outside and look at holistically, think about what we need physically, spiritually, mentally, in order to ensure children don't go into care. We're able to bring our children back, and to how do we strengthen our families and our nations and our clans to take care of their own. So that's it. Thank you, Lori.
Thank you, Mary. Helaina, Dr. Helaina Gaspard.
Good morning, everyone. Thanks again for having me join you today. It's always a pleasure to join you in these forums, and certainly to talk, about the work that's ongoing, and certainly in all of the ways that agencies and First Nations have absolutely been the drivers and have been absolutely instrumental in this work. Lori, would you like to go to the next slide or would you like me to stay on this one? Wonderful, thank you. So when we're talking about a reformed funding approach that both Cindy and Mary mentioned at the outset, what we're talking about are three things. One is the way the system is structured. The second is the amount of money that moves in the system. And the third is an accountability mechanism, or the way in which everyone can ensure that children and families are taken care of, not only now, but moving into the future. So this reform funding approach is connected to needs and is definitely connected to the differentiated points of departure of First Nations and agencies. And we do that by using a mix of indicators in a funding approach. Taken together, the funding approach is intended to be read holistically. So it's all supposed to fit together. Pulling apart the funding approach isn't helpful because it doesn't help to meet the complex and diverse needs of First Nations and agencies. So we think it needs to be read together. The other important element that Cindy and Mary mentioned was the block function. The idea that all of this funding would move to the service provider all at once, and it would be at the service provider's discretion to figure out how best to use that funding. That's really important because right now, funding moves in silos. So you have funding for programming, funding for capital. And sometimes that can be challenging when you're trying to respond to to needs in real time in communities and among children and families. So finding a way to make sure that service providers have flexibility and can make decisions in the best interest of children and families is quite an important element of the structure of this approach. Now, the Measuring to Thrive framework and those 75 indicators for well-being, those are across community well-being, family well-being, and the well-being of children. This for us is really the point of departure of the entire reform. When we talk about long-term reform, we hope that we can get to a system where the well-being of children and families and communities is at the heart of the system. And the best way to make sure that we are on track to that goal of well-being is to monitor different indicators over time. That monitoring is so important because it's a two-way accountability, right? It's the accountability for the service provider to their children, to their families, and also a way for the service provider to ensure that connection and that accountability of the federal government to ensure that over time, the resources, the practices, the approaches are all consistent with meeting that goal. So again, structure, the amount of funding, and accountability, the three critical components to a reformed funding approach. So if I can continue, Lori, thank you for switching the slide. On phase 3, so the work that's happening right now, what are we doing in phase 3 and why are we doing it? So phase 3 is all about taking what we learned in the previous rounds of work, the cost analysis, the development of the funding approach, the development of the Measuring to Thrive framework, and actually putting them into practice. That's really important because we have a model, we have an overarching vision, but what we need to do now is figure out that for individual agencies, figure out for individual First Nations that are exercising jurisdiction, what does this model look like for you in practice? Does the funding approach still hold? Are there things that need to be added? Are there things that were missed? Are there things that need to be refined or adjusted to ensure that whatever this reform looks like, it helps to reflect your reality? That's why it is so important for us when we're talking about using phase 3 to close gaps, to redefine baselines, to make sure that we get the refinement of the Measuring to Thrive framework right. That is why it is so important to please help us, agencies and First Nations not affiliated to an agency, to complete those questionnaires so that we have the most up-to-date information available when we're doing this work. Thanks, Lori. So one other important component that Cindy mentioned at the outset were the rulings and the considerations associated to Jordan's principle. So what we're seeing right now from different places all across the country is that Jordan's principle is being used as a catch-all to really address shortages or gaps that are coming from other programs. So IFSC is actively reviewing how we can best figure out a sustainable way forward for Jordan's Principle. And what we know from information provided by Indigenous Services Canada is we can see the number of requests, we can see the general cost categories of requests, but what we don't know and where there's a missing piece of the puzzle for us is really those root causes of the requests. And those root causes are really important because that's how we can start to address those longer term issues of substantive equality for First Nations children now and into the future. And so it's quite important from our perspective, when we're looking at a long-term funding approach on Jordan's Principle, that we need to understand what those root causes are of those requests to Jordan's Principle, and also how we can understand substantive equality. What might substantive equality look like to help ensure that those gaps that we're seeing from other places that Jordan's Principle is now closing, how those can be addressed. Jordan's Principle was meant to be a last recourse in emergency or exceptional circumstances. And what we're seeing now is that it's being used very frequently and it's being used as a catch-all. So that, to us, from a public finance perspective, signals that there are other challenges in the system that all of you know far too well. So the long-term approach to Jordan's Principle is about understanding where those gaps are in substantive equality and understanding why children and families are coming to Jordan's Principle to help close those gaps. So we'll be back to you hopefully with some analysis on that in the weeks and months ahead. Thank you, Lori.
Back to Cindy.
All right, so we're here at the compensation. I've been putting a few things in the chat just so that we can keep things moving along, because Lori's really good about keeping us all on time. A couple things I put in the chat is, one is that final settlement agreement for the class action. That is different than the human rights tribunal orders. That it goes back to 1991. It includes the group that is already legally entitled to 40. And what we need to see is that they actually provided that as a baseline. So when the compensation AIP was reached, the Caring Society is not a signatory to that because we're not class action council. We didn't see a role for ourselves in a class action because frankly, we just feel that that should be dealt with separately, that we stood up for the human rights damages and we really want to put our effort into long-term reform. So the compensation agreement and principles signed by Class Action Council and Canada. And they agreed on a fixed amount of $20 billion. The question is that going to be sufficient to give everyone who's already legally entitled to the $40,000 under the tribunal's order their $40,000 as a base, and give proper compensation to those who are being added to the claim? All of this has got to kind of come forward within a nesting of supports for victims. We're all really aware of how the trauma has created many young people who are struggling with addictions problems. Maybe some of their parents are as well. We also have young people from CARE who are really trying to reclaim their identities and set themselves up for success as young adults. So we have this whole continuum of need. And one of the questions that we have to all be looking for in this final agreement on compensation is the level of supports that will be available to these persons of diverse needs. Keep in mind, and this is a very critical thing to keep thinking about, 1/2 of all the eligible victims for compensation are kids. We've never confronted that before. We've had residential school survivors who are now adults being compensated for the harms done to them when they're children. Same with the 60s group. But we need to really turn our mind as community members and as for First Nations leadership about how will we safeguard children in particular. And one of the things the tribunal order puts in place is that all their money goes into trust until they're 18. That's one safeguard, and it looks like it's in this final agreement under compensation, but there are pieces missing. Some of the eligibility information is missing out of the final agreement. So we need to see that really filled in before we can really determine whether or not the 40,000 is actually secure for those victims. And we want to see more details on the supports that will be provided to persons who are eligible for compensation and their families. So I think that's all I have to say about that, other than that we've also been working with Youth in Care, as Mary said, and we've done a bunch of fabulous financial literacy videos. They're intended for Youth in Care, but I'm telling you, everybody, they're really great. And I learned some things about financial literacy. I really recommend you take them into your communities and share them with your family, your friends, and your nation members.
Thank you, Cindy, Helaina, and Mary. I want to say that, yes, Cindy has placed items into the chat, and Kayla Swing, part of our policy support, is also tracking questions. So please note that there will be opportunity for Q&A, and that will come at the end. So I'm going to hand the screen next over to Gregory Miller from Indigenous Services Canada.
Thanks, Lori. I'm a Sagatwin, Gregory Miller Diwayu, Laki Degu, Gitsum Kalam Alakolam Suawatku, Musqueam Squamish Soil Tuzlaku Diogzohu. It's an honor to be joining you today virtually from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh people in downtown Vancouver. I am originally from Gitsum-Kalam First Nation, and I'm a program advisor with Indigenous Services Canada in the BC Regional Office. Joining you today as the acting manager behind Bill MacArthur. Really want to acknowledge the work that the Secretariat has done to put this session together, acknowledge Deb Foxcroft for that great opening, as well as Regional Chief Teegee and the other panelists today. I'm going to be presenting a few slides on the implementation of immediate measures in BC region, giving a little bit of information on each of those three immediate measures, and we'll get into a bit more detail on the following slides. As my esteemed panelists have already mentioned, as of April 1st, immediate measures came into effect that were identified in the agreement in principle. Those three immediate measures include prevention services, post-majority care, and First Nation representative services. As of April 1st, 2022, prevention services are funded on a per capita basis of $2,500 per person living on reserve or on Crown land or in the Yukon. And this funding is intended to support First Nations and agencies to deliver an array of culturally appropriate early intervention services that support the safety and well-being of First Nations children and families. And that's being allocated between agencies, their affiliated First Nations, and to First Nations unaffiliated with a delegated Aboriginal agency. Post-majority care is a new stream of funding as a result of the agreement in principle that will provide funding on actual costs to support youth and young adults in care and formerly in care up to and including the age of 26 to provide funding to support those youth aging out of care and into adulthood with culturally appropriate services that respond to the unique, needs of that individual youth. The funding on actual costs will support an array of services, as I said, that respond to the unique needs of that youth, and we'll get into a bit more of the detail in the following slides. The last immediate measure is related to First Nation representative services, often referred to as band rep services. This will be funded on a per capita basis of $283 per person living on reserve and on Crown land or in the Yukon, and will support First Nations in having a voice when children and families from their communities are involved or at risk of involvement with child and family services. Next slide, please, Lori. Prevention. So as I mentioned, prevention funding will provide families with supports they need to begin addressing structural risk factors that contribute to the overrepresentation of First Nations children in care. The new prevention funding as a result of the agreement in principle will amount to an investment of $1.3 billion, which is approximately $900 million more than federal prevention funding to First Nations and agencies in fiscal 2021. Prevention services, including at the primary, secondary, or tertiary levels, evidence-informed and culturally appropriate, address identified risk factors and build protective factors within families and communities. There's sort of three broad areas of prevention that could be considered, either at the primary, secondary, or tertiary levels. Really important to note that, as Mary mentioned earlier, prevention, as it's defined by your First Nation, is really important. The First Nations and elders, knowledge keepers, First Nations and their service providers are the experts in the needs of their communities. And this funding, the way it's being dispersed for fiscal year 22-23 for communities that are affiliated with a delegated Aboriginal agency, the First Nations agency is being maintained at the funding level identified in their 22-23 business plan. This was really important to ensure there was no disruption in services and that the agencies are able to follow the legislative components as mandated by the British Columbia Child Community Family Services Act, as well as the minimum standards identified in the Act respecting First Nations, Inuit, Métis children, youth, and families. Communities that are unaffiliated with the delegated Aboriginal agency will be receiving the full $2,500 per capita based on the number of people living on reserve and on Crown land or in the Yukon. Next slide, Laurie, please. First Nations Representative Services is a new stream of funding in British Columbia. When the original merit decision came out in January 2016, it was only Ontario region that had band representative services as an eligible expense. As a result of the agreement in principle, First Nations Representative Services is being nationalized to First Nations across the country and is intended to be First Nations led and to support First Nations in having a voice, as I mentioned, when their children, youth, and families or community are involved or at risk of involvement with a child and family services system. There's a couple of examples on the slide here of functions or roles that, so I can go back, thank you, that may be included under First Nation Representative Services. So that could be serving as a main contact between First Nations and child and family services providers, providing cultural training or advice to stakeholders, delivering and supervising customary care, attending and participating in court proceedings, receiving and responding to notices under federal or provincial legislation, and ensuring that the cultural needs of a child are being addressed by a First Nations child and family service provider, and participating in the development of a child's plan of care. Next slide, please, Laurie. Post-majority care, as I mentioned, is services that will support youth aging out of care and young adults formerly in care across all provinces and in the Yukon from the age of majority up to their 26th birthday. Effective April 1st of 2022, First Nations authorized service providers can submit claims for reimbursement of costs related to these services to Indigenous Services Canada. We have been working collaboratively with the Directors Forum to establish a business planning model that agencies can use to support expenses related to post-majority care. We're also aware that a toolkit is being developed to provide awareness of the expanded post-majority care services within the First Nations Child and Family Services Program. The goal of post-majority care services is to provide wraparound supports that meet the distinct needs of First Nations youth and young adults, that promotes and supports holistic positive outcomes for thriving youth and young adults. Supports under post-majority care can include housing, food security, employment and social security, mental health, wellness and addiction supports, and fostering healthy relationships. Is there one more slide, Laurie? Okay, and that's it for me. There will be a time for questions at the end, but please post questions in the chat related to those immediate measures, and I'll be happy to do my best to respond. I think I'm turning it back to Mary. Thanks, Laurie.
Thank you, Gregory.
Okay,
Yes.
okay, I'll just speak a little bit to the final agreements. Definitely, there are the agreement in principle, of course, is a framework for the final agreement, but there's much work that needs to be done. Gregory had talked about that there would be a fully reformed funding approach, and that would be the one that would be March 31st, 2023, which would be this not even however many months. But keep in mind that what Helaina was talking about, what Cindy was talking about, there's still much information that we need to gather. We don't have all of the data. We only have some data. In the agreement in principle, we talk about phase 2, and then there's still the phase 3 work that needs to occur. We also have to have safeguards in place to ensure that discrimination doesn't occur again. So there is a talk of an alternative dispute resolution mechanism. And that I can't tell you how important that work is, because that's the vehicle that's going to ensure that discrimination doesn't occur again. The importance of that alternative dispute resolution mechanism cannot be understated, and we have to do this right. Right now, there has only been some work done on that. There's some draft documents, but nothing for certain has finalized, because really the intent of that is, if you think about it, when we won the Canadian Human Rights Tribunal ruling, when we got all the orders, we've had 22 non-compliance rulings and procedural rulings that we had to go back to court 22 times, and then the 3 federal appeals. Now think about that. That's one of the things that we have to make sure is when this Canadian Human Rights Tribunal no longer have jurisdiction over this, we need a process to ensure that we hold Canada to account. We don't know what's going to happen in the future. We don't know what government's going to get in. We don't know. But so we have to think about that in the future to say, what is the best mechanism that we can develop now with all the information that we need, that we know now, to ensure discrimination doesn't occur again? That is a lot of responsibility, a lot of work. And so we have to make sure that we get it as right as possible. So that is really the importance of that alternative dispute resolution mechanism. We also have to ensure that the work that we're doing is, again, those principles that we talked about, that is holistic, that is actually needs-based. And again, that's so important, because what does your community need in community? You have to remember, oftentimes our nations themselves, especially those ones that weren't affiliated, never received prevention dollars. I mean, so for certain, that's true in British Columbia. The monies went to the province, and the province was supposed to provide those services, but they never got that opportunity. So right now, we don't know what that's going to cost. So we need to ensure that we look at the quality of the work and that it's done correctly. We're not going to drop the ball at the very end. We have been working at this since 2006, long before that. And so now we need some more information and more time. So we need to ensure that it's, again, not these arbitrary timelines that we're looking at, but actually the outcomes, and that we're following those principles. We also have to ensure that nations that are working towards their jurisdiction, that they are also considered, that we cannot exclude any of our brothers or sisters. We have to make sure that those principles of holistic and culturally needs-based flexible funding is afforded to everybody in Canada. So I think those are just some of the my thoughts around the final agreement, and I'm sure Cindy has some to say. Thanks.
That's a great summary, Mary. And the only thing that I would add is we need to find a pathway for First Nations drawing down C92 to deal with the on and off reserve piece. Mm-hmm. Remember, 72% of your kids in the average community are off reserve. And what we've seen in some cases is, or that is kind of concerning, is that the feds will say, we'll only fund on reserve, and you got to reach an agreement with the province. You had an agency that was servicing on and off reserve and status and non-status kids. And what could come up is if you keep that eligible child definition only to status and the feds funding, then you actually might be sending kids away versus welcoming more kids, which to me is really what the goal should be, is like more kids and more supports and more culturally based care under C92. So that's an example of where structure of funding is really important, because it's not really to do with the level, although the levels are an issue, particularly off reserve now. Mary knows this with the great work she's doing on a class action in BC to get those levels up. But it's also about the structure. When we have governments doing these Mexican standoffs, which should have been dealt with via Jordan's principle, then kids and families can fall through the gaps. So let's make sure that we're keeping our eye on that as we go through this. We don't want to have spent 15 years filling up the bucket of hope, giving families for the first time a chance at prevention services, giving youth in care access to post-majority, only to have holes being made in that bucket from the bottom. And that is done in a way of structure that is going to leave communities and families in a difficult situation down the road. So I really think that this is important, and I would like to see this process completely opened up on the negotiations. That's no secret. I said that before. I say it again. I know that these are First Nations children from all across the country, and everyone should have an opportunity of seeing the major proposals that people are putting forward in the name of these children. So I look forward to the conversation.
I just think I would like to add one more thing, Cindy, and thanks for that. I think also, if you think about the amount of work that needs to get done, we cannot lose sight that one of the orders is that there has to be a system reform with ISK. So think about all of the years and all the different names: Indian Affairs, the Department of Indian Affairs, and whatever, Northern Development, and then now whatever it was, and now it's Indigenous Service Canada. Like all of these different names that went under, and all of the generational traits of that system that hasn't worked for our people, that has been discriminatory. And we're expected to reform that system within a few months. There is so much work that we've undertaken, but there's still so much work that happens. What happens when Cindy and I are long gone? We have to make sure that the system, if there still is Indian Affairs, that we have to make sure that system is not going to discriminate against our children and families again. So that's the really important body of work that sometimes I think gets overlooked, that we have to work together with our non-Indigenous, the people that are in ISK and our Indigenous people that are working at ISK right now, to ensure that we reform the system so that it is responsive and understands that we need to fund in a substantive and equitable manner, plus that recognizes our culture and doesn't discriminate. And so there has to be teaching of staff, a total system reform. So I just wanted to make sure that we remember that as well. That's part of the agreement in principle. Thanks.
Thank you, Mary. Thank you, Helaina and Cindy and Gregory. Very important work that continues to as we move forward. So recognize that there are a number of questions already in the chat, and want to say thank you to those that have placed your questions in the chat. If you would like to raise your hand and unmute as well, please use the reactions button to raise your hand so we can see you. There are quite a number of you on the call this afternoon. We do have two questions. And the first is from Narissa. Do you see this being extended to officer families where their children were apprehended as well? Cindy, I think you touched on that near the end, but I'm not 100% sure.
Yeah, I'm going to actually invite Mary to kick in here because she has a class action to kind of talk to us all about and share with the group. But before I do that, I just want to remind people about Jordan's principle and the gift of his family and of that sacred little boy's spirit. It was not just about making sure there's equitable access to services. It was about dealing with these on and off reserve issues where kids and families fall through the cracks. And what Jordan's principle said is that the government of first contact pays for the service, and then they can collect from the other level of government later. But the child comes first. And really, I think that should be applied in this context with child and family services. It shouldn't matter where the child lives. The government of first contact, in this case, the federal government, should pay for the service, and then they can set up a thing with BC or whatever province to get reimbursed if they want. What shouldn't happen is that we have service providers or families having to go to one level of government to get one child's needs met, and then going to another level of government and hoping that that level of government will also meet that child's needs. That is really an unworkable system, and it's really a recipe for discrimination to be happening for First Nations children, young people. So my solution to the whole problem is Jordan's principle, and also demanding that these provinces bring their funding up to standard, and while we work at continuing to urge the federal government closer to compliance. Mary, do you want to share your work about your class action you got going?
Yeah, so there's a few things that's going on right now. There is the federal court just approved about 7 days ago or 8 days ago a class action on behalf of off-reserve Indigenous children, and I think that is so important because we've often said that, you know, our children are everywhere, and our families are everywhere, and you know, it's the resources of our territories that fund the government to provide services. So to us, we don't see that off and on, and it's just an arbitrary line. So I think the importance of the certification of that federal court action is so important, because there is the onus on the federal government as well, because, you know, the fiduciary responsibility. It is discriminatory that we're not going to be funding our children that just happen to be removed off reserve. I think if you think about this in the practical sense, think about this. So we have post-majority services at actuals for on reserve. And so where we provide services to our children, and we're going to say, okay, do you remember you were removed off or on reserve, so you're federal billable. And so we're going to provide life skills, and we're going to do all this stuff in housing, but oh, you were removed off reserve. I'm sorry, we have no money for you. That is ridiculous. That's discrimination. So it's really important for the federal courts to have approved that. Of course, in the province of BC, along with Gowlings, WLG, and Batista, again, the same ones that are doing the federal case, we are looking at, we've filed already with the province of BC, again, because there isn't that substantive equality, the discrimination against our children. And so there is a movement. We are proceeding with those court actions to ensure that all our children, regardless of residency, get the services that they deserve and that justice demands, so that they can achieve substantive equality.
Thank you, Mary and Cindy. And please do prompt if there's a follow-up or if I am missing a prompt. The next question is from Lisa Weber. How do First Nations representative services reconcile with child and youth advocate legislation and policies within the provinces?
I would say that work hasn't been done. It's one of those things on our to-do list, is to make sure that there is kind of a seamless level of advocacy for different parties that are involved in child welfare. Band representative services are to represent the First Nation in the legal proceeding. In some cases we have, in Ontario, for example, children's lawyers. In other places we have children's representatives or child advocates. And we need to figure out a way of really coordinating this stuff. And so for me, I just get back to Mary's piece. I think we all need to take the time necessary to do this in a good way for kids. And we are serviced well by the agreement in principle that gives paramountcy to the well-being of kids. But that is an excellent question. And frankly, I think we would welcome your ideas. Helaina, are you getting any of that kind of information and questions when the work that you're doing?
So we're certainly trying to dig in a little bit deeper into the representative services position. And so we're open to any ideas. Lisa, I've made note of the reconciling question that you've asked here. We're certainly getting questions about a whole host of positions, including, you know, what to do with post-majority supports, what that funding flow might look like, what's eligible and ineligible. So always happy to receive those questions. They're certainly helping to nurture our analysis and frame the work that's happening.
Thank you. And the last question that we have is, why was the prevention funding limited to on-reserve and Crown lands when IFSD stated for all members?
So Perhaps I'm happy to start. So just to be clear, when IFSD when we did our cost analysis for the phase 2 work and for that study, the cost analysis that we used was specifically for on-reserve populations. The membership question didn't come up for us. We simply don't have that data in a consistent fashion. So the best data we had was on-reserve populations. I will note that the question of on-reserve, off-reserve is coming up all of the time, no matter where we are in the country. And this is something that's a real preoccupation for us. And so we're actually trying to look at ways that we can better understand, for instance, by asking agencies, by asking First Nations, how many people do you serve? And we don't ask about residency, because we recognize that sometimes people move into the community, out of the community throughout the year. We also recognize that there may be people living in the community that are not necessarily members. So on the one hand, we are absolutely looking at that question of territory, but also looking at different ways of trying to capture the people that are served, full stop, wherever they might live.
And I would just remind everyone, the remedies that we're getting here are related to the Canadian Human Rights Tribunal case that was brought against Canada. So the provinces weren't named in that case. And we couldn't bring that case, frankly. Only First Nations in the regions could have brought a case against the province. That is not something that we could have done. So that's why you're getting all of these investments really going on reserve. One of the questions that we need to have more of a conversation about is the Canadian Human Rights Tribunal's order says that the funding should go to all people on a per capita basis on reserve. It does not restrict it to Indian registry. And so that's just something that we're having conversations about, just to make sure that First Nations are not being disadvantaged by that.
Cindy, and I think really also the question, like, why was it that we did the on reserve? Because at the time, if you read the back in 2006 already, remember there were like many reports. There was a Wendy report, the Auditor General report, and at every step of the way, the Canada had the opportunity to remedy their discriminatory funding. And the comparator was the First Nations agencies compared to what Canada was doing, or what Canada was, how they were funding based on per capita. So we looked at, ourselves, for example, in British Columbia, what we were getting paid, and you compared that to, say, a social worker. So in that case back then, I know that as executive director, I could only pay my social worker so much money, and it was between $3 to $6 less than an a provincial worker. Plus, we didn't have money for prevention on reserve. So there was that comparator. We needed something to say this is a discrimination.
The next question in the chat: will funds be available for children who weren't taken but went through trauma and later being victimized by intergenerational trauma?
This is a really good question. I think I'm just going to clarify with Sheldon that I'm going to answer, because I think you're asking about compensation. But if that's not, if I'm not getting that right, please just correct me, and then we'll try to get the right answer, because your question's important. When it comes to compensation under the human rights damages, the tribunal listed children in care and children who were removed from their families because they had to, for example, go to a hospital or go to a specialized clinic because they were denied at-home care in their own families. Those are the people who are eligible for compensation under the Canadian Human Rights Tribunal orders. Some families and children who were together, stayed at home, still suffered trauma related to denial of services under Jordan's principle, they're also entitled to $40,000. I put a link to the tribunal's orders so you can see who's eligible and who isn't. We need to look carefully at the final agreement on compensation to see who's in and who's out, who is eligible and who's not. And that question for me is still not answered. There's some stuff where the final agreement says we'll get more information in a few months. That information is actually really critical to answering that type of question. So I don't know, Mary or Helaina, if you have anything else you want to add to Sheldon's good point there. And there is, I'll put it in the chat too, Sheldon, there's an information line you can ring about compensation to get more details from those class action folks directly. So I'll put that in the chat as well.
Maybe just before we hand it over, there is a question that you may have already touched on as well, Cindy, was the question from Muriel. What about the children off reserve who did not gain status until 1985 or later?
Okay, so is that to do with Jordan's principle, or is that the good news? I'll just answer it in terms of Jordan's principle while we have a good look. And in terms of Jordan's principle, we have got a fantastic order from the federal court on that. And that is that First Nations children, regardless of whether they're registered or not, this is something that looking at the 92 should read this ruling. It is important. So they're off reserve. If your nation's principle, this is very important. It's in more of a nation recognition piece. And then a second piece that a lot of folks don't know is your nation, say if you don't have a process for recognizing children for Jordan's principle. Let's be clear, it's not for anything else. It's just for getting help under Jordan's principle. If you don't have a process for doing that, the government actually has to provide you with funds in order to consult with your nation and come up with one. So even that can be covered off. This is a very important piece. And in terms of compensation, it would be for children who were affected by the federal First Nations Child and Family Services program or the federal implementation of Jordan's principle on human rights class action. But there is one off reserve. It's just at an earlier stage of development. I don't know, Helaina, Mary, did I get that right? Is there anything you want to add?
I think that's good, Cindy. And just because you kind of cut out, I don't know if everybody cut out, and that's just where the nation can develop their own criteria as to who is going to be able to access Jordan's principle, which is hugely important because, you know, the right for us to determine who are citizens, it kind of lends itself to that whole sort of self-determination. So I think it's really important to, you know, access the funding to develop your own process.
Just also doing a bit of timekeeping. We have approximately 13 minutes left for Q&A. So our next question is, after the 42 children and families, will there be any money to invest in community infrastructure that is so badly needed?
Yeah, that depends on what they agree to in the final agreement and how many people come forward. When you agree to a fixed amount, it really depends on the leftover amount, or even if there's enough money, depends on how many people are actually entitled under the class action. That's a question that we still don't know an answer to. In terms of getting your infrastructure addressed, I think this is where the Spirit Bear plan is so important. I'll make another plug. And actually, Helaina, data on Jordan's principle is leading in that direction too. Jordan's principle, in some ways, is funding underfunded other programs on reserve. And we, the leadership and some of the folks, the experts on the call, you'll remember we did the Spirit Bear plan, and that got approval by the Chiefs and Assembly in 2017. And what it is cost out all of the inequalities facing families and then remedy those inequalities so that we're not spending decades and years trying to get basic dignity and public services for families. So my recommendation is to advocate strongly for implementation of the Spirit Bear plan by both the federal government and by the provincial government, because this case is not going to be able to remedy all of those structural inequalities you're talking about. The other thing that I might do is, and please forgive me, I think it's Gregory from ISK. But if Gregory could kind of maybe let us know if there's a nation who wants to get the funding for Jordan's Principle on defining their who's eligible for Jordan's Principle. Is there a process in BC that they should undertake? Maybe you could share it with us.
That's a very good question. I can definitely take that back to the Jordan's Principle unit and send that out either through the Secretariat broadly to everybody on the call or to the individual with the specific question. And as well, just on the capital front, we could talk for days on this topic alone, but we do have we have a unit available in BC region to support First Nations under the CHRT 41 capital order. And maybe, Lori, that could be a takeaway is maybe we organize another session specifically on CHRT 41 and the process available to support nations in accessing funding for capital projects, either the purchase or construction of assets that support the delivery of the First Nations Child and Family Services Program. And that CHRT 41 process is available to support nations wherever they may be on the spectrum of being ready to purchase or build a capital asset. So whether you're at the capital needs assessment to identify what your needs are in your community, all the way to the actual design and construction of a project. So technical staff are available to support nations in navigating that process and provide any assistance that may be required. So maybe that could be a subsequent session. Mary, I'm not sure what your thoughts are on that, if that would be helpful for us to collaborate on, just because there wasn't enough time today to get into the full presentation.
I think that's a really good idea right now, because I know I'm just fielding so many calls from everywhere. So I really think we should have another session, just capital specific. And I know often I've been getting the question around what is a capital for Jordan's Principle, for example, what are we talking about with that? So I think maybe that would be a good session to follow up with. Plus, I can see how many questions we have, and I got text, so we're not going to be able to go through all the questions today.
I see quite a few nodding heads in agreement for another session as well. So we will collaborate with that. And this might be a dual response as well in terms of the next question. Are there any guidelines on how First Nations communities set up the structure to administer the prevention funding?
I'm going to let Helaina take this one, and then I'll just add on to it.
Thank you, Cindy. So there are a couple of different pieces that are really, that we think can be quite helpful. First and foremost, we'll be working with just about 20 collaborators, First Nations and agencies that will help to raise different approaches to designing and developing prevention services and programming. We know that this is time intensive and certainly costly. So we're doing our best to highlight what's already happening on the ground and what we can learn from existing service providers. Critically, we also anticipate that a First Nations-led secretariat should also help play a supporting role on this prevention design, prevention program delivery front. So in the vision or in the design options that we're preparing for providers, for stakeholders, is a secretariat that would help to collect these practices, help to collect these programs, and certainly make them available to providers across the country. And that for us is something that we've been hearing in different forums, and certainly from different providers and different groups of providers, that kind of function would be really helpful. Almost like a library, right? Where you can pull down program ideas, HR, components, cost analysis, all of those sorts of things. Over to you, Cindy.
Yeah, I think this, how do you start from the ground up is such an important question. And that's why it's also just a big shout out to you, First Nations, who are in that situation. Please participate in the research, because we need to know where that's at. But you have expert colleagues and agencies who have already laid some track on this. And I'd really recommend you reach out to them to see what the processes were that they undertook. What were some of their lessons learned? What are some of the best practices? And I'm going to say best practices in quotes, because sometimes I worry we talk about best practices, but we don't talk about the conditions that made those practices possible. And that's as what really important. So ask your First Nations agency colleagues, what kind of services are most effective? How did you make that happen? All of those pieces are there. And also in the chat, I've been kind of putting together some of the resources that you could start from, looking at what are the actual needs of First Nations? What are those drivers that Mary talked about? Well, their poverty, their addictions, their mental health, their poor housing, their domestic violence. You have to drive your prevention money towards those if you're really going to make a difference in culturally informed ways. The other piece is to look at some of the other interventions. For example, there was a lot of attention given to birth alerts. Well, it turns out that there's no evidence that they work, but there's also not enough evidence to say they don't work. So we need to look beyond just kind of what our emotional responses are to these issues. And I say they shouldn't be used because there's no evidence that they work, but actually looking at interventions that work. And so I just posted a review that has been done on interventions with substance misuse. There's other tools that are out there. And really look for people to work with you who have got a lot of experience in First Nations Child and Family Services. Thankfully, there is people out there who have that expertise now. And often it's done at low cost or free or just for kind of being supportive in your communities. And on your data front, Helaina didn't have time today, but she has got a fabulous software program that could help you start to identify where your kids are at now in terms of the outcomes and how to track those over time so you can calibrate your services to the actual needs of your community members. Mary, do you have anything else you want to say?
Yeah, and thank you for that, Cindy. And I think, and again, that's a lot of some of the questions that I've been asked. So one of the things that we have, and across Canada, you do have, like, you have the FSIN, you have Quebec has got a, sort of a more of a provincial system that really reflects the Indigenous ways of being. But so one of the things that I would strongly recommend that remember this. Our leaders all those years ago really wanted to be able to have a say in what happens to their children and families. And really that is what jurisdiction is at the end of the day, is having the ability to make decisions. So back a long time ago, the delegated agency was made as an interim measure until you get to that place, and also to build capacity. And so there are agencies that have been around, like for example, our agency has been around for 30 years. And so all of those lessons learned and what Cindy's talking about, those wise practices, we did that with very little money, the prevention services that we have. So we are, so reach out, because for us, it's one of our principles of being Indigenous is generosity, is of love, and a child is a child is a child regardless. So the best way is to, to reach out, because I know for us, for example, like, we're willing to share our information. We do have the goal we have the Indigenous Child and Family Services Directors Forum here in British Columbia, which is comprised of all the 24 delegated agencies that are in BC. So we are starting to catalog all of the, the different types of forms, templates, information around insurance, all of these things. We're getting that in one place to help those nations that aren't part of an agency, to help them develop their prevention programs. I think we're also going to have a provincial, but we've just sort of agreed just recently to have a national conference coming up in November, where we're going to talk about operations and administration, legal and governance issues, jurisdiction. We're going to talk about prevention and practice, and then have people from across Canada to teach, to tell us what they do, what's working in their area of the world, and then have that information. We're also really looking to, especially when it comes to post-majority, is collect all those toolkits for youth services. For example, we have a toolkit about how to run a culture camp, if that's what you want to do, right from the very start to the very beginning, all the forms that you need, all the liabilities and all the risk, but all the good things too that we've learned over the last 20 years of running culture camps. So there's a lot of good work that is out there. So especially if you're, especially a smaller nation, you've never received the funding and you really need help, reach out to your agencies for sure, because I think we're all in this together.
Thank you, Mary. So we are coming to the end of our time together. I want to say thank you for all of the questions and the very rich discussion, and recognize that there may be many other questions. Do want to say that the PowerPoint and the recording will be available once we complete our session today. And as you have heard here on the call, we will be hosting future calls as more information becomes available, as well as we continue to move forward with the AIP. I would like to turn it over to Deb, who is going to close our call in a good way, and just want to say thank you once again for all of our presenters for collaborating and being on our call today, as well as everyone that has accepted our invitation. And over to Deb.
Well, thank you everyone for being here. I just want to hold up my hands and acknowledge all of you for being here, and also especially to the warriors that are here working on behalf of our children and families. You know, Cindy and Mary Teegee and Helaina and Terry Teegee and all the other champions and leaders that we have working on behalf of our children and families. As I always say, this is heart work, and it's so very important to all of us that have been in this field for many years. And just wanted to acknowledge those warriors, your strength, your determination, your courage. I know that in the day when I was working in child and family, it was about, we had to deal with the stuff like blood, sweat, and tears because of how hard it was to try and ensure our kids were getting the best services and our families were being supported. And as Indigenous people, we've always been so creative with the little resources that we've had, but we all did our best to do this work. And so I'm just very encouraged that we now are at a place at least to have more prevention dollars. We've been asking that for a long time. And also in terms of, you know, our culture and our language and our teachings, that is now being valued and seen as a prevention, as prevention for our children and youth and families. And I think that's been so important. And in terms of our self-determination to work on behalf of our children and families. So to all of you that are here, thank you for being here. This is, again, important work. And I just wanted to say, you know, that our children are precious, our children are cherished, and our children are valued. And so as we leave today, I just wanted to say, I always have quotes, and so I wanted to just say, wherever you go or do, whatever you do for children and families, leave a heart print. And if you, and then open up your heart and then open it wider. And I just wanted to say, and there was another quote that I read, instead of thinking outside the box, get rid of the box. So again, just sending love and prayers and healing to everyone that's doing this important work on behalf of our children. And we all have a responsibility to our children. Let's just ensure we have those champions in our organizations, in our communities, in our leadership to move this forward. As I said, our children and youth and families have been waiting a long time. Thank
you. Thank you, everyone. That completes our call, and our hands continue to go up to you in this hard work. And to our presenters, I hope you see the wonderful messages in the chat as well before you leave. So thank you, everyone, and we will see you next time.
Thank you.
Thank you, everybody. Take care. Keep safe.